I'm going to show you something that if you learn this, and by the way, it's going to be available on videotape. I do this at every single lecture. I do lectures on stress and hormones, bones and hormones, digestion and detoxification, and metabolic typing. Those are my 4 famous lectures that I'm known all over Southern California for doing, at libraries, at grocery stores, the ones that have, you know, the Whole Foods ones with the big vitamin departments, and anywhere else they'll have me come and talk. So those 4 lectures, and at every single lecture I do this because it really communicates to people, in my opinion. So learn this and you'll be able to communicate the difference between allopathic, which is treating symptoms, and functional, which is what we do, which is getting to the root cause. So there's a little quiz involved. I won't pick on anyone in particular. Okay, I will. David, what's that big organ in your skull that allows you to think called?
Brain.
All right, see? Well, listen, I asked that question because in my office I was doing this one time, and I phrased the question that way because I just had a man and his wife sitting there, and I said, well, what's that thing that allows you to think called? And he just pointed to her. And she went, that's right. So now I ask it that way. And the brain is connected to the, let's just say this is the body. And there are certain ways it communicates. Just name a way, anyone. How does the brain communicate with the body? Someone said nerves. Awesome. Another way. The blood, okay? And what travels through the blood? Hormones. Okay, that's good enough for now. So the brain's communicating with the body. Just the whole idea is that there's all this communication going on with the body. For what purpose? And in the title of today's seminar, the purpose is function. We need everybody to be functioning the way you were designed. And one of the tenets and basic beliefs of, I think, metabolic typing and functional diagnostics is that we're designed pretty darn good. Perfect. It's, some people might say immaculate. I don't know about the rest of you, but anyway. Really good design. And that, believe it or not, is what normal is. Now, who here has ever had a client that said they had a symptom but they thought it was normal? Raise your hand if you've had a client say that their headaches were normal, or that they just had normal aches and pain, you know, that kind of a thing. We all do. Because people confuse normal with common. And so headaches and digestive disorders and complaints are very common, but I don't believe they're normal. And a basic tenet of our work is that they're not normal, that you're really designed for great function, and a body, we'll just say that it's in a state of ease. That would be a good, you're a licensed practitioner. Ease, we mean homeostasis, right? Homeostasis would be the medical term for this. So let me ask you guys, if you're communicating, all systems are on go, and you're functioning normally the way you were designed, in a state of ease, would you be healthy? Let's all agree that that's what healthy looks like. Anything other than that is something else maybe, but that's what healthy is. Healthy is functioning normally in a state of ease. Is that how people come to your practice? They always come with what? Some kind of complaint, or they usually aren't there. I do get a few that say they're pretty perfect and they just want to do some testing to make sure that, you know, the whole anti-aging thing. And once you develop your reputation and start getting good referrals, that's what you're looking for, is the people who don't really have any complaints, and they just want to fine-tune everything. And so anyway, most people don't, though. They come with something else. We just call all of that symptoms. But wait, you say, we just said that this person was healthy. They can't have any symptoms if they're healthy, right? So something must be askew, and we say that they've lost ease, or they're out of homeostasis. We'll just call it dis-ease. Now, Denise, back there, I want to make sure you can hear me. Disease. I don't know if that's where the word disease came from, but it's maybe. But it's certainly not a state of ease. They've lost homeostasis. That's why symptoms occurred. But something is still askew. We said, well, if they're functioning normally, they wouldn't be in disease, right? So they must have lost normal function. Not 100% anymore. As a matter of fact, the word we use is malfunction. That's why they've got disease. That's why they've got symptoms. And this is where our work is. And this is the primary differentiation, primary difference between what we do and what most care today is based on, which is symptom removal. Is that a bad thing? No, that's not a bad thing. If someone comes in pain, you certainly want to give them some relief. So at the bottom of that screen over there, it says 3 types of care. Well, there's the first type right there. Relief care is very important. We want to get people relief. Matter of fact, if you don't, guess what they're going to do? They're going to go somewhere else to get it. And a lady calls me up just last week, and I'm having hot flashes, something terrible. She's from Texas. Something terrible. It's so hot, and I'm just sweating, and I'm drenched. She give me the whole story like that. She just wanted relief. And I said, well, you know, I'm Reed Davis. I'm the functional diagnostic nutrition guy. What I do is a lot of testing. We need to send you a 205 and a 1. She goes, I don't want to do any testing. I just want to get rid of these hot flashes. So what I did was I charged her for the kits and then sent her the relief care. No, but anyway, no, she's doing the kits, I promise. But we do not focus here. What is most relief care based on, by the way? Pills. What is the ultimate type of relief care? Let's say pills don't work after a while. Pills and, you know, that's what's next. Thank you, Curtis. Good job. Now, who knows who John Lee is? Okay, John Lee, the women up front, the sympathetics, they know. John Lee is the guy who wrote the book, What Your Doctor May Not Tell You About Menopause, What Your Doctor May Not Tell You About Perimenopause. He is a famous guy. John Lee, he's an MD from California, actually. He's the one who stepped out of the box of conventional medicine back in the 90s, started doing saliva testing. He's like one of the, you know, the original mentors of all of us that do saliva testing. Back in the 90s, he was doing it. He discovered that most women had a progesterone deficiency because of stress. I promise you're going to see how that works today. Just you're going to see it plain as day. And he told a funny story. Matter of fact, at a lot of my 90-minute lectures, I go over John Lee, and I used to play 15-minute videos of him. And he tells the story about a lady who was really sick of conventional medicine. And she finally came to see John and tell me the story. And she says, well, you know, I'm just really sick of Western medicine. It's just like they only ever want to treat your symptoms. And I really wish I could just find out what's really wrong with me. Okay, tell me the story. She goes, well, I had these pains, and they gave me pills for a while, and the pain went away for a while, but then it came back, so they just cut my ovaries out. And he says, okay, go on. She says, well, then I got this pain right up in here. And they said it was my gallbladder, and they gave me gallbladder pills. She goes, and then finally it got so bad, they just took my gallbladder out. And John Lee says, well, wait, just stop. Don't tell those doctors that you get headaches. So I want to get across the point that there's nothing really wrong with relief care as long as you get to the underlying cause and don't let it get too bad to where they need surgery. So how do we do that? If we go back up, and our job is going to be to find the source of malfunction. I'm going to leave this right here over in the corner because we're going to refer to it throughout the day. This is your master diagram and plan. You guys learn how to do this, and you'll be able to explain to your clients what's going on. What we want to do is find the source, and here's a new word for you. Everything that causes malfunction, I call stress or stressors. That's your new definition. It's expanded definition of the word stress. Today, we're talking about hormones and chronic stress-related disorders. And this includes everything from mental, emotional, which is what you usually think about. When I first said stress, Most people thought about getting to San Diego on time, you know, the travels you had, or you couldn't find the right kind of food, or whatever it might be. You don't like your spouse, or you don't like your job, or something, or your kids, or whatever it is. Now, me, I remember I worked at a wellness center where the owner's a chiropractor, and she's a really good one. And what I learned is that there's a whole lot of ways that there could be physical stress on the body too, especially on the nervous system. So all these things are affecting you. Mental, emotional, that can be on your nerves. You know, they used to say, hey, oh, it's just your nerves. Or don't worry, honey. You know, that guy's on your nerves. He'll go away. Physical stress, subluxation, they call it in the chiropractic. And I understand that there's a lot of different ways to deal with that. Denise is a massage therapist and holistic health practitioner. She works out the knots, gets that pressure off the nerves. Our realm in this course, what we're going to deal with is more the chemical, and that's just a broad term, chemical stressors. It's really all the functionings inside the body of the hormones, the deficiencies nutritionally, and all that sort of stuff. So that's what we focus on, is discovering the cause, the malfunction, by looking at the stressors. That's your whole job, if you ask me. Because then we get people back to normal function. And this just disappears. Their body goes back into a state of ease. They should have no symptoms. So symptoms are great clues. We do want to give people relief care if they're really hurting. But we want to really get them to focus on this area. We'll call that corrective care. This is the other kind of care, corrective. So that's what functional diagnostics does, is corrective care. And last but not least, once we get them in that state, we would do maintenance care. So that's your 3 types of care. Put another way, let's look back at the screen now. This is the medical model versus the subclinical model. This is the medical model treating with, this is the subclinical model. So if we look back to the screen, you're going to see, my pointer's working here, that most medical care is based on intervention and relief. Can you all see the red dot? So what is that? Intervention and relief care is dealing with all of these things. Infection. Where we work, because we're not physicians, we're not really qualified or going to deal with this a whole lot. We don't want to work in that model. We want to work down here with the hormone system, the immune system, the digestion, and the detoxification systems. This is where we can provide the most help. And by the way, I have a medical director. I highly recommend all of you try to find a doctor that you can work with who will sign off on your blood work and just maybe coach you up. If he's a really good doctor, he ought to be proud of what you do. I know that my medical director is a good friend of mine. He's an osteopath. His name is Dr. William Bailey. And he said that by working here, we're doing just an unbelievable amount of good, and really like hundreds of times more than any of this could possibly be to a person. This is where life and sustaining and anti-aging, and it's what we get to do. That's so much fun.